This young child's brain is a sponge. As this child takes in the world around her, she fixes her gaze on her parents' faces, closely watching what they do and coordinating her actions to match theirs. It might not look like much is happening, but this process of observation and imitation is a crucial step in learning. This child with autism, however, rarely makes eye contact and may not respond to her name being called, and so she frequently misses out on these opportunities to observe, mimic and practice behaviors, learn new words, and acquire social skills. Ultimately, these missed connections could lay the foundation for some of autism's defining traits, such as difficulties with social communication. Early intervention, however, could change that trajectory. There's a suite of therapies that mostly involve teaching a young child new skills during ordinary daily activities, such as play. These early interventions are often tailored to a child's interests and are designed to reinforce helpful behaviors. For example, if a child reaches for a truck, her mother might drive it over to her and try to engage her in a shared activity, like loading it up with sand and dumping it. If the child repeats the game later with another playmate, her mother might reward her. Although this looks like simple play, it's teaching the child to coordinate with another person to focus on the same object, a skill called joint attention that's typically delayed in autistic children. That's just one example, but early intervention therapies create multiple new avenues for children to learn crucial skills such as joint attention and symbolic play. Some studies suggest that when delivered regularly from an early age, these interventions can enhance an autistic child's language ability, boost her social skills, and generally lessen the severity of her autism traits. And yet, the evidence base is strikingly slim. Rigorous tests of early interventions have been few and far between, and most involve only small numbers of children. As a result, many studies show modest effects and have been hard to replicate. That makes it difficult to really prove what interventions work. What's more, because autism has such a diverse spectrum of traits, no single approach will work for every child. But the field is evolving. Some experts are testing interventions in larger, longer-term studies so that they can separate children into subgroups based on their traits and determine which groups benefit the most, and for how long. Other researchers are trying to pinpoint the active ingredients that make interventions successful, whether that's the length of time they're applied for or at a specific age. Knowing what makes a therapy work could help researchers better match interventions to the children who are most likely to benefit. Intervention studies also lack diversity and have mainly involved white, middle-class families. That means excluded groups may lose out on effective treatments. To remedy this, researchers are gradually shifting away from clinic and lab-based tests, which leave out many families by dint of geography and socioeconomics. Instead, some are partnering with schools and training teachers to deliver interventions. Other researchers are training parents to deliver interventions in their homes. Going a step further, some experts have also begun to use telehealth methods to train parents and other caregivers in intervention techniques, and to deliver treatments to children remotely. One unexpected benefit of the lockdown brought on by the global COVID-19 pandemic has been the growth in virtual treatments. Altogether, these changes and innovations are inching the field closer to its ultimate goal: to develop personalized and adaptive interventions tailored to each autistic child's needs. As the field transforms in this direction, so will the lives of thousands of children.